And welcome everyone to our Croí Connect series, where we aim to answer all your burning cardiovascular questions and questions related to a healthy lifestyle. This week, we're here with Trish Galvin. Trish is an advanced nurse practitioner in stroke care at Galway University Hospital. And Trish is going to answer your questions on the warning signs for stroke and give us some of the best advice for stroke survivors. So thanks very much for joining us, Trish. Stroke can be very frightening for people. So we've received quite a few questions. So it's great to get them all covered. So to begin with, perhaps, can you tell us, please, what the warning signs for stroke are? We got a question in from Michael, who is cocooning at home with his wife, and he's concerned about watching out for the signs of stroke. He's heard a little bit about the FAST campaign, but wasn't sure what FAST stood for or anything like that.
Thanks, Trish, and thanks for inviting me on to do this education piece. I suppose the first thing to note about stroke is that although it is, as you said in your introduction, quite a scary event to happen to somebody, just to reassure people that there is something we can do to help people with. But the key thing is that you need to seek that help. So with stroke, the thing with the stroke is that it happens very, very suddenly. So the onset is very sudden. It comes without a warning. So, you know, sometimes people might say, oh, well, I felt faint and I felt I was going to pass out. You don't tend to get that warning when you're having a stroke. It can be that you were sitting at the table having a cup of tea and you went to lift your arm to reach for the tea, but your arm wouldn't move. It can be that quick and that sudden. Or for some people, they go to bed that night, at night and wake up in the morning and have a loss of something. So maybe unable to move, unable to speak. So their stroke has happened during the night. And that's one thing with stroke, is that it doesn't tend to wake you at nighttime. So for people that wake up like that, we tend to go back to when they were last seen well. So stroke is very sudden and you usually end up losing something. So you lose the ability to do something that you're normally able to do. So for instance, it can be that you can end up not being able to move one side of your body, be that your arm or your leg. You may have a droop on one side of your face. You may not be able to speak. You may not be able to stand. You may not have balance. You may not be able to read. You may not be able to understand what somebody is saying to you. You may not be able to see very well, where your vision can be very doubled and distorted, or you may have lost some of your vision. So to recap, for the warning signs, it's very sudden on onset. You end up losing something, so losing your ability to do something you normally were able to do. So Michael, to focus in on your question on what the FAST stands for. So FAST stands for face, arm, speech, and time. So with the face, we're looking for if somebody has got a drooping on one side of the face, and it's usually here at the corner of the mouth, or we have these folds here in our skin that we normally see. So that can get flattened and you can get like where the jaw can drop down along with the side of the face. So, and if you ask somebody to smile, you will see that their whole mouth doesn't show and they don't show their full teeth, their big gums. Some people may not have any teeth. So it's their gum line that you're looking for. So that's the face. Then the arm. So with the arm, again, it can be a total loss where somebody might not be able to move their arm at all, or they may have some movement in their arm, but it may be very uncoordinated. So if you were reaching for something, you may feel like that you're all over the place and trying to reach your destination. You don't have that smooth, fluid movement in your arm. You may have a very subtle weakness and you may not notice it until you go to pick up something and you feel that it's dropping out of your hand. So with a loss of power, it's not always that dense pelagia. So what I mean by that is where you've got no movement. It can be that up to a very subtle, slight loss. So that's the arm. And we also use that for the leg as well. So even though it's arm, if you've got the same problem with the leg, where your leg won't move for you or you will not allow you to take your weight on it, again, that's a weakness and a loss of power. The next one in the FAST, so you have F for face, A for arm, S is for speech. So there's two different things when we look at for speech. One is a slurring of your words, where it sometimes can feel like that you've got some cotton wool in your mouth and your words aren't coming out as clearly as you normally would. And somebody might say to you, have you been drinking? It's that sort of a slurred, sort of a drunken speech. So that's one thing that can happen with speech. And the other is that you actually lose your ability to speak. Now, you may be completely mute and not be able to get any words out at all, or what you may have is difficulty in naming, or you might know exactly what you want to say, but the words just won't come out for you. So we had often ask somebody to name some common objects. So we would pick up a pen and say, can you name this? And they'd be nodding and smiling, and they know the word is pen, but they just can't get it out. They may say you write with it, so they may have a way of getting around that, but they're not actually getting that one word that you want to say. Again, people can present to hospital and people say they just became really confused. So if somebody, but you yourself, you know you're not confused. So that's just one of those things to watch out for, especially if it's a loved one that you come across and they're behaving like this. It can be an expression of their language, that's the problem. And also for some people, they may not understand what you're saying. So your understanding of what's being said can be affected as well. So I know that's a lot to take in with speech. So you have two things. You've got your slurring of your words and your speech is a bit mumbled, or you've then got an inability to talk or an inability to get some words out, to say exactly what you want to say, but what's coming out makes no sense, or you may not get any words out at all, and the understanding of what's being said to you. So that's speech. And then T is time. So it's really important to know, so if this is something that you witness, or if this is something that's happening to you, if at all, if you can't, try and note the time that it happened, because it may be some while before help arrives. And when you're thinking back, gosh, was it an hour ago, a half an hour ago? Time is really important from our point of view in the hospital, from what we can do to help you. So the time of which you've either found a person with stroke symptoms, that you were with them, or that they happened to you, please try and note the time you can. And also it's time to seek help. Having a stroke is a medical emergency. So please call for an ambulance, call 999 or 112 and tell them that you're having a stroke. Please avoid calling your GP, because that can delay. You know, your GPs, and especially now in COVID situation, a GP can be very delayed in getting out to you. We have 4.5 hours from a stroke has been witnessed in order to be able to deliver a clot busting medication. So that time is very, very precious. So that's what the FAST stands for.
Thank you, Trish. That's really, really clear. And I think that will help people to understand, you know, what to look out for, but also the importance of doing something about it. My next question is a little different in that, you know, they're wondering, are there different types of stroke, or does this matter?
So there are different types of stroke. And I suppose when we look at different types of stroke, I'm going to sort of maybe take two angles on this, Trish. So the first angle is going to be on the type of stroke that you get. And what I mean by that is you can have a stroke. I'll tell you exactly what a stroke is first, and it might be easier to explain. So a stroke happens when you get an interruption in the blood supply to the brain. So for some reason, the blood that goes into the brain to carry oxygen and glucose gets blocked. So two main causes of these blockages and the two main types of stroke is where you can get a clot in one of these blood vessels. And the fancy word for that is an ischemic stroke. So that's where a clot can form in the blood vessel in the brain. It can also form in other parts of the body, but we won't go too much into that. But where the clot can travel up to the brain, it blocks a part of the blood supply. That part of the brain then gets starved of its oxygen and glucose. And that's what causes the brain damage, which then ultimately causes the signs that you end up losing as a result of that. So that's your clot, and that's by far the most common type of stroke that we see. So up to 80% of people would have a stroke due to a clot in their brain. The second type of stroke, which can be caused again by an interruption, is when that blood vessel bursts and causes a bleed in the brain. So that causes a hemorrhagic stroke. So that's the medical term for it. But it's, again, you still get that interruption in the blood supply. You still get that area of brain deprived of oxygen and glucose, and you still end up with brain damage. So we have no way of telling what type of stroke that is until we get you in and do a CT scan. That's the only way we can tell whether it's a clot type of stroke or a bleeding type of stroke. And the differences in treatment, there are some depending on what type of stroke you present with. So that's probably the type of stroke. Then the other, when I hear that question of what types of stroke there are, can be to do with what part of the brain gets affected by the stroke. So the front part of your brain controls a lot of your movement, your thoughts, your language, your ability to understand things, your ability to be able to know how to make a cup of tea and to have the proper steps in place. So all of these things that we take for granted are all stored in the front part of our brain. However, to the back part, the other type is that can affect the back and the posterior to the back of the brain. And that controls a lot of your coordination, and it can control your vision. So you can get types of stroke depending on whether it's a clot or a bleed, but you can also get different types of stroke depending on what part of the brain has been affected, if that makes some sense.
Absolutely. Thank you. That's really, really clear for us, because lots of people will ask, you know, what types of stroke, and they're talking about what part is affected really, when in actual fact, oftentimes when we're talking about whether it's a clot or whether it's a bleed, and presumably the treatment is different. And again, back to what you were saying, that time is so important.
Yes.
So thank you so much for that. That's very clear. Just on that time as well, you know, we're hearing in the news that people are delaying attending hospital, probably out of fear of contracting COVID-19, or, you know, they're frightened. Are you seeing that when it comes to stroke?
So I suppose in the beginning with COVID, and for all of us, this was something very new and something we all had to get to learn about and get to terms with very quickly. Let alone in Galway and in Ireland and worldwide, there was a big worry that our numbers were down. People were just not coming in with stroke. And about twice a year, we get this natural lull in stroke where we can get a week or two where thankfully we're getting low people presenting with stroke, because you know what, we like being not busy because that means people aren't getting strokes. However, that's not the reality. But certainly for the first 2 weeks, our numbers were way down, and we were worried, were people staying at home and afraid to present. But however, certainly over the last 2 to 3 weeks, our numbers have picked back up again, and people are not delaying. I think we had one person that stayed at home for 2 days, thinking that this might get better, not realizing they had a stroke. But certainly people are coming in, and they're coming in quick. They are not delaying, which is good. And I suppose I want to reassure people that here in Galway, in the hospital, the management have put in huge amount of work in streamlining people and keeping people safe as much as we can. So our whole ED pathway has changed. So when you come in, even from being the ambulance going out, we know what pathway, and when I say pathway, whether it's non-COVID or maybe there could be a suspicion of COVID, there's different pathways you go down, and we're very prepared for it here in the hospital. So there's a lot of work being done to ensure that regardless of whether COVID is here, we can still give you the exact same treatment that we always did. So there's nothing that has really changed from that perspective. The only thing is you'll see me with a mask on, you know.
Yeah,
that's about it.
That's great. And that's really reassuring for people out there to know that the team is there, that everything will proceed. I'm delighted to hear that people are not delaying really as much as they may have been. There may have been a fear around it. And that there's the individual pathways then when people do come in, which is great. So that kind of covers the general sort of stroke idea. And then just to get into some of the concerns that individuals have, we have a question here from Catherine, whose husband had a stroke 2 weeks ago. So he's in hospital. She's unable to visit really due to the COVID-19. What should she expect, and you know, how can she maybe prepare for his discharge coming home?
Yes, that's the one aspect to providing care that we find challenging, because we very much involve the family, and we always say to them that they are very much a part of the team in stroke. You know, you've got the patient, you've got the family members, as well then as you've got our therapists, doctors, nurses. So it is huge. And not having that family involvement it's quite difficult. However, we do regular Zoom meetings with families. So you can call in and we can set up a Zoom, and we can also do multidisciplinary team meetings. So depending on what Catherine's husband's deficits are or what needs he has, the therapy would very much be focused on that. And during these Zoom meetings, you can get an update and have an opportunity to ask your questions and be very much involved. A lot more sort of planning goes into discharge because of not having that hands-on, being able to walk somebody through and spend that time with somebody. It's very difficult over the phone to get a sense of what somebody's feeling or thinking. But not to be afraid. I mean, we do plan. Everything is very much as it was, that we always did, but it's just that the person isn't here with us. So don't be afraid. And I would certainly say, if you have any questions, to write them down. And therapists will call, the docs will call, I will call. You know, so don't ever think that it can be difficult, but don't think that you're annoying us or not. If we can't talk to you at that one time, we'll take a number and call back. But I would hope to think that you can still feel you're very much involved, because it's scary. Stroke, although it affects the person that's unfortunately suffered the stroke, it also affects the family and the wider family as well. You know, it is something that spreads out and causes upset, you know, quite wide.
Sure, yeah. No, that's really good advice, and you know, really reassuring as well, you know, that you are all there, and that despite everything, as much communication is still maintained, which is great, really.
Yeah.
So then we had a query from Pat, who's a stroke survivor, and he's wondering about whether or not he should continue to keep taking his medications.
Okay. Yes, Pat. Don't use COVID not to take your medications. Yes. And I suppose on medications also make sure you have a supply in, not to run out, you know. So that's very, very important. So have an extra supply in. Yes, take your medication. If there's anything you're confused about or worried about, call the GP. If you don't get anything, the information that you need there, feel free to call us. You know, we can go through things with you, go through information. We may need to pull your chart and refresh ourselves, because it's not that we forget about you, Pat, but you know, people move on, and we just need to make sure that we're giving you the proper information. So take your medication, continue to do so. If you finding side effects, if you're finding an issue with your medication, chat to your GP first of all. And if there still is problems, feel free to contact me back here in the hospital. It's no problem.
That's great. Thank you. That's great, Trish. So this one kind of links a little bit in with that, because if somebody needs to have a blood test, say they're on warfarin or something, or they need to attend for a checkup, how's that happening? How do they go about that?
So I suppose for warfarin and blood tests like that, it would be with the GP. So that's something that they would have to arrange with the GP. A lot of our clinics are now being virtual clinics, so people are being contacted over the phone. If there's any issues, they're trying to bring in some people if it's something that can't be dealt with over the phone. But of course, it is trying to limit interaction and flow through the hospital. But certainly, If it's something that we're worried about, we will always tell you to come back in. And that's the advice we give any of our patients going home. If it's something new is happening, if you're not feeling well, if you're unwell in any way related to your stroke, please come back in. You know, we can see you, assess you, and decide what the further plans would be from there.
Great, great. That again, really reassuring and great advice.
Yeah.
On the bigger issue then, you know, people who've had a stroke and survived, are they at higher risk of contracting COVID-19?
It's very hard to say because this is so new.
Yeah.
There is a lot of research sort of going on in stroke and in relation to COVID. I wouldn't necessarily say that they're at an increased risk of developing COVID. I suppose I could turn it around the other way. And what we're seeing coming out of the research and literature is that people presenting with severe cases of COVID seem to be developing clotting disorders. And some are having strokes. Now, it's not just clot. So when you can get a clot, it's not just the brain that can be affected. You know, you can get them in your lungs, in your legs, in other parts. So certainly coming out over the last 2 months, and again, this is only something that we're trying to learn about every day, and that they are seeing that there is some rare blood clotting effect happening with people that develop severe COVID illnesses. So I suppose it's flipping that question around and putting it the other way. And you wouldn't be at any more risk of having COVID if you're following your proper hand hygiene, your cocooning, and not having people coming in. You know, COVID affects everybody, or can affect everybody equally. You know, you just have to be careful and limit your contact with other people. Sure.
So the general usual precautions are important.
Yeah.
Okay, look, that's all really, really good advice. So I suppose to wrap up a little bit, have you any other advice for stroke survivors or their families, or any key messages that you'd like to communicate?
Okay, so what I'm going to say, I suppose, while we're unwinding from cocooning and we're getting a little bit of easing of the measures, it's always no harm to be prepared. So when what I would say to people is, have a list of your medications that you're currently on ready. Back to knowing your air code. Your air code is going to be very important for everybody in these days. So know your air code. Have a list of your medications, or if you're living with somebody, have their medications as well. Also have a bag prepared. You know, I know not everybody has gone through childbirth and has had babies, but everybody that had a baby has a bag prepared for hospital. So it's no harm just to have, because if you are with somebody and they have a stroke, it's very, very frightening, and you may not be able to think straight. And especially in these times of COVID, you won't be able to come to the hospital as often as you can to, you know, see the person, to bring a change of clothes, to bring toiletries, you know, stuff like that. So have a little bag prepared. One thing I don't want to see in the bag is slippers. I hate slippers, because slippers do what slippers, they make you slip, they make you fall. So put in a pair of runners or something that's got good sturdy footwear to help us when you're doing your rehabilitation. So have your list of medications, and on that list maybe write down if you have any illnesses like high blood pressure, diabetes, and maybe an irregular heartbeat. So things that would be important if you have any major illnesses, bleeding disorders, because that can really, really help us when we're assessing somebody in the emergency department. Because a lot of time we spend going back, making sure that it's safe for us to be able to deliver the blood clotting medication, and we have to work through a whole load of processes. So if we have that information to hand, that's really, really important. So be prepared if you can. So have your list of done out, have maybe your medical history, a little list. It doesn't have to be very detailed. Have a little bag prepared, ready to go if somebody needs it. You know, I know that might sound silly, but it's no harm, you know, just something that's put away. The other thing is, please seek help. It is a medical emergency. And unfortunately, I suppose stroke doesn't always get that same maybe message across out to people as when someone's having a heart attack. This is a brain attack. It's an attack to your brain, similar to an attack to your heart. So the sooner you get into hospital, you will be in a better place for us to be able to potentially give you the treatment that we can, you know. So the quicker you get in, the quicker we'll be able to help you. The same processes are in place in our hospital in Galway, so don't be afraid of that. And we're here and we're ready.
That's
they want to see, but you know, unfortunately strokes happen, so we're here to help.
Thank you so much, Trish. That's really, really good advice. Lots of reassuring information there and lots to take on board. Thank you so much for joining us here at Croí Connects. We'll be back. Croí Connects returns in about 2 weeks' time, and we're delighted to have Professor Sean Dineen joining us then. Sean is consultant endocrinologist and the National Lead for Diabetes Clinical Programme in Ireland, and he's also a lecturer in medicine at NUI Galway. So get your questions now for Sean. Visit croí.ie, or you can give us a call on 091 544 310. Don't forget to stay tuned to our website. We've got lots of great resources. Follow us on Facebook, Twitter, and Instagram. You'll find us at Croí Heart Stroke. Thank you for watching. Take care. Bye-bye.